Naomi Fitzgibbon. I'm the Director of Nursing and Services. And we also have Paula and we have Lisa, who are the incredible ladies that do all of the equipment. And they're going to do an introduction to how to order equipment from the IMNDA and what we do and what we don't do and how to do it. What we're going to do is, first of all, just start with an overview of the IMNDA and what we do and some of the other services that we have. And also, if you have questions, if you wouldn't mind, please putting them in the chat and we will get to them at the end of our short presentation. We are recording this, so we will share it in the evaluation to you so that you will have it. We will put it up on the website as well, and you'll be able to refer to it. So we're not going to keep you too long either. So it's a very quick introduction. It's our first webinar, as I said. There will be more, so keep an eye on your emails for that. So I'm going to start, and then Paula is going to follow on with me. So just a quick introduction to the Irish Motor Neuron Disease Association. So we were established in 1983 by a small group of friends. It's a national service, which is comprised of equipment. Lisa, I think I'm getting feedback from you. Sorry about that. If you go on mute, that might be better. Yeah, perfect. We also provide financial assistance, and we get 15% of funding from the government. Most of our funding comes from fundraising, which is done by our incredible fundraising team and our communication teams. Next slide, please, Paula.
Yeah.
So we do have a strategic plan, and everything we do within the organisation is evidence-based on the needs of people using our services, so people living with MND, their families and carers. And we are really part of a much bigger community-wide service for people living with MND, and all of our services are geared towards that. So we support patients living with MND, their carers, healthcare professionals within the community, and other allied healthcare professionals. Next slide, please, Paula. So the role of the IMNDA is to really improve symptoms of people living with the disease. As we know, there's no cure for motor neuron disease. So what we try to do is anticipate the needs of the patients. We try to avoid crisis. We adapt the environment for the person living with the disease, and try to maintain their independence, their autonomy, and ensuring that we provide as much dignity and quality of life as possible for the individual and their family. Next slide, please, Paula. At the moment, there are around 440 people living with motor neuron disease at the moment, and this changes. It fluctuates all the time, but it's generally around 400 people, 450 people that we support. So every day we are responsible for supporting that level of patient cohort. So there is one person diagnosed every 3 days, and unfortunately one person passes away every 3 days as well. We also are here to support the carers and here to provide education and support to any allied healthcare professional. So the way we manage our service is very much a team approach. The person living with MND and their care is in the centre of the circle, and we work with all allied healthcare professionals within the community and within the hospital service to try and make sure that that person has what they need to live with MND. We try and be as prompt as possible with any interventions. As soon as we notice something is occurring, or we try and predict what may be coming down the road, we try and be as flexible as possible. And that happens with frequent assessment from the nurses, but also liaising with people working within the MDTs, whether it's in Beaumont, in Cork, in Galway, or in Kerry. And also the nurses work within the community MDTs as well. So they would attend MDTs within the community as well as within the neurological sites around the country. We do have a clinical advisory panel, and which is comprising of people working within the motor neuron disease area, to advise us of horizon scanning issues that are going to come down the track in time to come, so that we can be prepared for them. We're also involved in the Irish Neurology Nursing Forum. One of the nurses, Moira Hayes, is on the committee, and that is a really, really important piece for nursing around neurology nursing in Ireland, and make sure that the education is there for us. So the team are here or not here. The team step in to support somebody with motor neuron disease and their family from the very word go. So as soon as somebody is diagnosed, once they register with us, they're connected in with the nursing service and with the services around the services equipment around that piece as well. So the nurse is really at the MDT at the very beginning when the diagnosis happens, right until person is no longer needing of our service and until the very end of care. Some people don't register with us because they don't feel that they need support at the time of diagnosis. Some people will register later on, and that is absolutely up to them. We don't demand that people register with us. Nobody has to, but if they want to access our services, it's essential that they do register with the organisation. Thanks, Paula. So just a very quick snapshot of some of the outputs that we had last year. So as you can see, the nursing and support calls and emails is nearly 19,000. So it's a very, very busy active service, as you can imagine. There's nearly 800 home visits. We carried out 120 professional education sessions with people in the community, in hospices, in hospitals, and we're more than happy to provide that service as well if it helps anybody supporting people and working with people with motor neuron disease. And also, we don't look after just the family, it's also we support the carers and the family as well. And that is a huge piece of work as well that we will be developing into the future. As you can see, we've worked with a lot of healthcare professions as well, because we don't do this support the people with MND on their own. We have to work, and we're delighted to work with the allied healthcare professionals as well. And just as we're talking about equipment today, we have a value of equipment of around 2 million, but in our stores, so to speak, which we use Healthcare 21. And we had in circulation at the moment, there's around 800,000 worth of equipment, which is a huge amount of equipment. Thank you, Paula. So we also have grants for people living with MND and their families. So one is the home care grant, which is to support and maintain independence for people who want to stay at home in their home, and we provide a care grant for them up to €180 per week to top up HSC payments. We also provide counselling for people and their families living with MND, but also bereavement counselling as well. And we have a holistic therapy grant, so these can be accessed through any of the MND nurses, and all of the information of where the nurses are is on the website as well. So one of the huge fundraising events that happened, I'm sure you're aware of it, was the Charlie Bird Climb with Charlie, which was a very successful fundraising campaign. It was really, really brought the country together. It was a very high profile campaign, and it was in association with Pieta House as well. So when we received the funds from the fundraising, we did a survey with people and their families and carers who were living with MND to see what was the needs that they thought that we should develop. They definitely wanted another nurse, so more nursing. So we appointed a 6th nurse. We contribute towards clinical research projects because that was one of the wish of people as well. So we do support Professor Orla Hardeman's Trinity College research. We're funding voice banking service, which Paula will go into in a little bit more detail. We have a recharge grant, which is for people to stay in a hotel, and also a transport grant. And all of the information around this is on the website as well. We're developing a caregiver grant, we're developing a respite grant, but with the hospices, but that's a longer term plan. And we've just started on that as well. So more to come on that one. So I'm going to hand over now to Paula. Paula's going to talk about the equipment services and in more detail than I did, and I'll keep an eye on questions for you because we'll do those at the end. So over to you, Paula.
Thanks, Naomi. Hello, everybody. You're more than welcome to join us today on our very first webinar. We're very excited. My name is Paula McNally-Crenn, and my colleague Lisa McNally. We organise all the equipment. We're in charge of all the equipment. And as you all know yourselves, equipment means all sorts of things, including equipment for speech and language therapists and physiotherapists. So you're all very welcome, and we'll try not to bore you too much, but we'll go through it with you. So this is just a kind of a really quick breakdown about how to order equipment that we have. What we ask you to do first of all the people that, anybody with MND, if you need equipment for them, they really need to be registered with us first. Unfortunately, we can't do equipment if they're not in our database. So I won't read word for word because we'll be here for a couple of hours. So the first thing I would ask you to do is, if you need something from us, just send in an email with what you need and who you need it for. We'll talk later on about GDPR because we are covered. So the main important thing, as Naomi mentioned, is we have all of our stock in our warehouse in Anacotty, County Limerick. So the first thing we would ask you to do is either register with Asset Track, because you have the availability to go on yourselves and have a look and see if something is, you might need something for a particular client. Myself and Lisa are not medically trained, so we need your experience to pick out the correct item. If you're not registered, now we can have you registered with Healthcare 21, with Asset Track. If you're not, we can send you a list of what we have, and then we would love you to go through the list and pick that particular bed, that particular mattress, that particular wheelchair, and then we'll send it out to you. Now, unfortunately, on Asset Track, you can't deliver or collect, but we'll do that for you. So just keep us up to date on that. And that will be the start. And we've mentioned then, if there's no access to anything on Asset Track, if we don't have something available that you need, we ask you first to kind of go to the HSE and say, I need a particular item, and see if they have it, because that's the first port of call, of course. If they don't have it, we can apply for funding. Before we get to that point, I suppose, we will send you a requisite form if you need to fill out something to say that you've borrowed it. If the HSE are not in a position to fund the item, most importantly, if the time frame isn't suitable, then come to us and we will try to purchase the item. Also very important is that all IMND equipment has to be reusable, because it goes back into our warehouse, it gets decontaminated and cleaned, and it gets sent out again, which is really important from our point of view. So these are the quotes, these are the main headlines again, which I say it's all on the website. If you need to buy something from us, or you're asking us to buy something for you, we do ask you to come through with 3 quotes, because some companies are much more expensive than others. And then we decide which one is probably the best. Be very careful, everybody, trying to get stuff from the UK. We're having huge issues, not only with tax and VAT, but with timescales. Just to mention here, very large items like wheelchairs or wheelchair parts, they seem to be taking a long time. So we buy them in Ireland, but a lot of the parts come in from Germany, France, the UK, and that can be really, really a long time. So that's something to keep in mind if you're thinking further down the line that you might need a special piece of equipment for one of your clients. Don't think about it the month before he or she needs it. Try and think possibly, will we need a wheelchair in 6 months? And then it's easier for us to help you through the situation. When the person no longer, we'll send out the equipment to you via our team in Healthcare 21 for delivery. When the equipment is no longer needed, let's say, contact us as soon as possible, and then we'll take it from there. Sometimes, obviously, you already know, everybody, that the families might contact you and say, we need to have this collected. So please, no problem, just send us in an email and we'll take it from there. What I'm going to do is, I'm going to do the other way around. I'm going to go down first to something that we don't do, and then I'm going to jump back. So you later see our little smiley face there. He's a bit sad, because we want to be able to offer everything. but we can't offer everything. That's just unfortunate. So the equipment that we don't provide, and again, apologies, we don't provide mobile scooters, fortunately. Wendy-let sheets, sleeping systems, which are the pillows to put people in different positions. We can't reuse them. They just end up in a warehouse. Unfortunately, we don't do feeding items, cutlery, aids, etc. If people need house adaptations, bathrooms, best thing to do is go to their county council. We can help them with a support letter, but we couldn't go as far as adaptations. We don't do mobile phones or laptops, and we don't do double partner beds. And these are the big beds that have two profiling, one on each side. Unfortunately, we don't do those, and we don't do the through-floor lifts, which are the beautiful lifts that go up and down with the glass. We can't reuse them. They are a millimeter when they're measured to go into a hole. What we do provide. So we try to provide as much as possible. So we start off, we have bathroom and toilet equipment, which would be shower chairs, commodes, all that type of thing. IOB day is something that has to be assessed. But if you need a IOB day for a client, just email us, and then we'll ask our supplier to go out, assess the home, and if it's okay for a IOB day, that's absolutely fine. We do bedroom aids. We offer a lot more beds, obviously, than the HSE do, because we want our clients to stay at home as long as possible and to be as comfortable as possible. So we do 3-foot beds, we do 4-foot beds, which is kind of in the middle, and then we do a 4'6". Just remember that the 4'6" beds are very hard to get into homes. So we need to make sure that this person isn't living in a very tight home where the bed can't go up or down the stairs. We also need 2 drivers to get the beds up and down. So just make sure when you're ordering, if you're ordering a double bed, can we get it into the house? We also have then different mattresses. We have high spec foam, hybrid, and air. I'm going to go back then. I mentioned it there about the OTs. We need OTs and SLTs and physios to ask for any equipment. We can't have a client calling and saying, I need a wheelchair. Of course you do, but we'll get onto the OT, because we don't know what kind of a wheelchair he may need or she may need. So we do, as you can see, there's a photograph there. I'm not sure if that's a Quickie 500, but we have a lot of powered wheelchairs. So we do a lot of powered wheelchairs and also manual wheelchairs. Again, we mentioned that an OT needs to access the client. Moving and handling, hoist, slings, transfer aids, and then the lift up chair for the bathroom. Again, we need the client to be assessed by an OT. Okay, stair lifts. Stair lifts, we're really delighted to be able to offer this service, because it's really, really great for people who live upstairs and don't want to move downstairs. So Lisa is our specialist in stair lifts. So again, you're going to be so tired of me saying email, email, email. You'll never get us on the phone. The phone is hopping a lot. Also, when it comes in by email, we have it on record, so we can attach it to the client's file, and we have it all sorted. So we work with a super company called Delta Lifts, and we provide straight or curved, but it depends. Some stairs might be half and half, so that has to be worked out. So we don't do, as we said, through-floor lifts or ceiling track hoists. So the person living with MND, their house has to be assessed by our supplier to make sure it's okay for the lift. Brendan, who is our supplier, is phenomenal. He's fantastic. It depends on what he has in stock. So it can take anywhere from 1 week to 6 weeks. So again, try not to over-promise the client. It'll be ordered, it could be 6 weeks. At least then they're not waiting for somebody to arrive in the next week or 10 days. Seating and positioning, again, we endeavor to get the right chair for the right person. So we have riser recliners, we have the seating matters, tilt and space, comfort chairs. Again, we need an OT to be able to assess the client. Some people are very tall, some people are smaller. So we do have the odd pediatric chair that will help a smaller person. Again, this is why we need to know, we don't know the measurements. Measurements wouldn't really mean an awful lot to us. So make sure that you do assess the clients beforehand. Physio equipment is also very helpful for physiotherapists out there. So we're really proud about having our motor meds. A couple of years ago, we only had about 10. We now have over 30 motomeds in work, and they're all out and about. So this motomed is really popular for people to be able to use their arms and their legs if they can't or they don't want to go out. It's just great for them. They can watch TV and keep their muscles going all the time. So again, very important is that if you're the motomed at the moment, the waiting list is about 2 to 6 weeks. What we ask the client or the OT or the physio to do is send us in the request. We'll send you back a form. Send it back to us. Do not send it back to Lincare. Lincare, the company we buy the physio bikes from, but we can send you an email regarding the same information. Then we also do the neck collars for people who are not able to hold their neck. So we do the soft grey one, which is heads first. We have small, medium, and large, and then we do the taller made. So the taller made is the one that's actually a hot gun is needed. So if you're ordering a taller made, it has to be basically put onto a client by somebody who knows what they're doing, and you will need a heat gun. So the taller made is a great collar, but it's not for everybody. So when we're sending out a tailor made, we will send you the information linked into YouTube as to how to apply to tailor made collar. Then assistive technology. As you see, the list is endless. We could, so assistive technology is changing all the time and in a very good way. So we try to work in collaboration with CRC, Enable Ireland, and an OT who knows. We've few very good OTs up in Donegal who know a lot about assistive technology. So we use the eye gaze, the grid pad. We're now using Dynavox, Toby. So we have a lot of new pieces of equipment that are really, really important for people to get on with their, be able to communicate, obviously, in a home situation. Not everybody, assistive technology doesn't work for everybody, but a lot of people are so happy to use it. So anything like that, again, let us know. We do need a long time in advance. Again, I know none of us have crystal balls, but if you think, at the moment this person is great on the iPad, maybe they could use assistive technology, try and get in there a couple of months beforehand so that we have time. Assistive technology and the word urgent don't go together. It's nearly impossible. So if somebody says to me on a Monday morning, I need grid pad by Friday, I'll have to be honest with you, everybody, it probably won't happen. It's too complicated. So yeah, if you kind of tell us in advance, that would be super. Going on then to communication aids. So you'll see down on the photograph on the right hand side is myself, my colleague Lisa. This is our average daily output of communication aids. So we send out iPads, obviously we provide Predictable, the app for people, and we provide SpeakUnique. We'll talk about SpeakUnique in a moment. Headsets, voice recorders, voice amplifiers, and call beds for people at home, and task alarms. Just going back to the voice recorders, we don't seem to be getting an awful lot of requests anymore, because since SpeakUnique has come into play, the voice recorder is nearly obsolete. After saying that, it's not a problem. If you need a voice recorder, email us and we'll let you know. SpeakUnique, I'll come on to in a second. So just getting back to this, these are all iPads, whatever they are, going out. So bear with us. We're trying to get everything out to you as quickly as possible. Just getting back to iPads for a moment. If you're asking for iPads for a client, please make sure they know how to use them, because iPads are expensive. And what happens is sometimes they'll go out to a client. We prefer to send the iPad to the speech and language therapist, to be honest with you, because if they can come into you in the clinic, you can say, this is how it works, and off they go. What happens sometimes, and I know that's not always possible, we're all incredibly busy, but sometimes what happens is we'll get a phone call from Joe and he go, I have an iPad, do you have the account number? And instead of, basically, if you're giving an iPad to a person, they need to put in their own account on Apple. And again, this will go out with letters when we're sending out iPads. Please ask them not to use two-way verification. It kind of messes up our system, two-way verification, and passcode. Passcode isn't the password. It's the passcode like on your phone, 4 numbers. try not to use them. But that will be going out in letters to you with all the information. Okay, so we're on to the SpeakUnique. SpeakUnique has been phenomenally popular, obviously. And as Naomi was saying, we're able to fund this through Charlie's Climb Up the Mountain. So it's a way of people to do their voice banking without sounding like, you know, not an Irish person, let's say. So, you know, original voice banking would be kind of a little bit more synthetic. SpeakUnique sounds like your own voice. It's absolutely phenomenal. So people find this really great because they sound like themselves. So they're able to go on to SpeakUnique and record. Usually it's, Lisa, if I'm right, it's about 300 sentences, 200-300 sentences.
Sorry, Paula. Yeah, 300 they would prefer, but they will make a voice out of 150.
Perfect. So that's the idea. Unfortunately, we can't afford to provide laptops. Now, they will need a laptop or a PC and a headset. We provide the headsets, that's no problem. It can't be done on an iPad or it can't be done on a phone. It has to be done on a laptop or a PC. Once the voice is ready, then we pay for it. So if anybody wants SpeakUnique and you're not really sure how to do it, email us and we'll send you how to do the SpeakUnique. It's fairly simple. Again, if you need information, email us in the queries. At the moment, we have been waiting on the book, I Will Always Be Me. Now, it hasn't come out yet. We're just kind of having a few teething issues with the UK. At the moment, SpeakUnique is working fine. People are delighted with it. So if it's not broken, let's not fix it and we'll just go with the flow. Everybody's very happy with SpeakUnique. Again, any issues, please don't ask a client to pay for it because we can't reimburse them. We need to pay for it on our side. And then that's the end of that. We can't reimburse because we're a charity. We can't just kind of, be putting money into people's accounts for no reason. So that will go out in the letter if you want to apply for the SpeakUnique. Where are we now? So this is a kind of, we are doing our best to really help everybody stay, on top of things and have everything done. So we're doing our best to really try and be patient with us. Myself and Naomi and Lisa and Johanna, who does our grants, we're pedaling, underneath the waters, trying to get things done. So we really are doing the best that we can. So I'm sure you all feel the same way when we're all running around trying to help everybody. So I'm kind of exaggerating on the email. If you call us, we'll ask you to email, because if we put the phone down, we won't remember who we've spoken to and we've no record. We have to have a record of what's being requested for a client so we can put it straight onto their file. So this is our email address, services@imnda.ie, and we will absolutely do our best to get back. If we're having a good day, it could be sooner, but please give us between 48 and 72 hours. Also, this is very important, everybody. In a lot of companies, you feel that you're not allowed to say the people's name. You are absolutely covered. So we are compliant with GDPR, and we have permission from our clients. The minute they register with us, they say, yes, you can use our name. So if you want to order a bed for Mr. Joe Smith, you can say Joe Smith, you can put his date of birth. Then we don't have to go looking for one of 25 Joe Smiths or JS in the system. It would also be fantastic if you could say maybe, especially if it's a very popular name, you could just say maybe Kildare or Cork or Galway or Donegal, and we go, that's the guy. So that will really help us save time. So when we save time, you save time. I think that's more or less it. We have, we've said earlier that we'll do a lot of questions and we're here to answer all your questions. So I'll pop that back over to Naomi.
Paula, I'm not sure that I can't hear the volume on that, so you might want to stop.
Great.
Can you hear it?
Yep.
We can't hear it, Paula, so maybe we'll stop the video and we can send it in the presentation so people can look at it. So there's something miss with that. So if you want to stop sharing, and then we'll have a look at the questions.
Perfect.
Okay. Thank you, Paula. Well done. And Lisa is there as well. Lisa, is there anything that you wanted to add that we may have missed over?
I don't think so. I think more or less everything was covered. As Paula said, anything that you need, if you email us, we'll either get back to you with that we don't have it or we don't fund it, or that we have it in stock and send you the list. For anyone wanting to register an asset track, the only issue we're having is that if people are already registered with the HSE, we can't add them. That email isn't valid. It won't allow us. So if they would give us a private or a different email, we can then register on asset track, and it would only be for registration. It would never be used for anything else. So that's just an easier way to get onto asset track. Otherwise, it means that we have to copy and paste lists of equipment. It would just be easier for the OTs or the SLTs to see the equipment themselves. I think that's it. I don't think you've missed anything, Paula.
Right. Thanks, Lisa. And just to let you know that we will be recording, we are recording this video, we'll be sending it out, and that we will ask for an evaluation as well. But just, we have some questions in here, so let's have a look at the questions.
I might just ask you to switch off that video. It's on in the background, the sound.
Oh, okay.
That's perfect.
I think it's your thing.
Could be.
Yeah.
Perfect.
Okay, so let's have a little look at the questions here and see. Can any allied healthcare professional request assistive technology? Does it have to be an SLT?
Will I answer that?
Yeah, sure.
No, any allied professional, absolutely. Healthcare professional, but it has to be something that you understand. So for example, if you know what piece of equipment you're requesting and you're able to set it up in the home, absolutely, no problem.
Yeah, cool. Do you have any shower buddies in stock, or have you funded them previously? I don't know what a shower buddy is.
I don't know what a shower. I don't know what a shower buddy is.
If we don't know what a shower buddy is, we don't have them in stock, and we could look into that. We'll have a look into shower buddies and see what they are.
We do shower chairs, we do shower commodes, shower buddy. It might be the same thing. It might have a new name.
Okay, we can look into that. Maeve, yeah, thank you, Maeve. I got a motion med really quickly recently for client growth service. Thank you so much, Emma.
Thank you.
Is it possible to obtain funding for clients with small aids, e.g. cutlery, cups? Unfortunately not, because they're not reusable. And it just, with the storage and decontamination and trying to track them and everything, Eilish, it's just a little bit too much hard work on that one. Thanks so much, Miriam, to April. Long shot, but do you consider providing service to clients with Emma? Given it follows very similar. Unfortunately not, Orla. Our constitution is purely for people with MND, and that's where our fundings and our policy and everything is geared towards. So unfortunately, not at the moment. Yvonne, SLT did I have 2 technology companies for quotes, not 3. Is that okay? If that is all you have, Yvonne, that is accepted, as long as you have a rationale why there's only 2 and not 3. That's perfect. We're trying to follow HSE guidelines, and we're looking into all of that as well when it comes to funding, because we do get some funding from the HSE, so we have to abide by their rules, because if we're audited, and if anyone's been audited by the HSE, you know how it is. Thank you for the highlighting presentation. If a piece of equipment breaks or requires service, is there a means to do this through the IMNDA Asset Track?
No.
No. Okay.
So email straight into services and we'll create a service call out or repair straight away. Yeah.
Great. Okay.
Sheila there, sorry to interrupt, has just asked a question. If you're logged onto the HSE Asset Track, is there any way of accessing the equipment? No, you can see all of the equipment, but we will order it for you. You can tell us what you need, but all the equipment is there for you to see.
Sorry, Sheila, I missed that one.
That's fine.
Hi to the anonymous attendee. Kira, does the community SLT get notified when device, e.g. iPad, delivered to client?
That's a very good question, actually, Kira. Normally, when we send out an iPad, we prefer to send it to you, so therefore it will be delivered to you and not the client. If you're asking us to send it to the client for whatever reason, we can do that. But we have a lot of iPads going out, so I wouldn't know when or whether or not they've received it. So I think the best thing to do is, if you've ordered an iPad with us to go to somebody, we let you know that iPad is leaving here today. It should be with client tomorrow. So you can just double check with them. It's kind of a similar question. When we order equipment for new equipment, especially, we will give you the purchase order number of that piece of equipment so that you can follow up with the supplier. So it could be Acora, or it could be Meditech, or it could be Healthcare 21. So you can follow up with the supplier what's the kind of ETA on it. It's very hard for us to follow up. We're constantly working on a daily basis. So we're kind of hoping that you will follow up for us, that people have got what they need. So something like an iPad, if it doesn't go to you, just say to the client, give me a ring when you get the iPad, and then that would be great.
Okay. And is it okay? Don't fund ceiling tracking hoists. Do you provide gantry hoists?
No.
No, I think it's...
Sorry, no. Again, there's something we can't reuse. So the gantry hoists and the ceiling hoists are gone into place. Once they come off the wall, they're really difficult to put up somewhere else. So unfortunately not. We do provide all other hoists. And we forgot to mention, Lisa, as well, we do ramps. We do portable ramps. Yeah. We can't do the concrete ramps because they're an adaptation, but we can do portable ramps. So unfortunately, ceiling hoists and gantry hoists, no. So sorry.
Okay. From Katie, hi, I just want to say thank you for all the work the Society does. I have linked in many times with clients. Paul and Lisa is one of the best sites. Oh, thank you so much, Katie. It's great to get the feedback. The girls are just working so hard with the whole team. So it's wonderful to get that feedback. Thank you very much.
Thank you. And actually, while you're on there, Naomi, saying earlier, we'd be delighted to get your feedback on today's webinar.
Oh, yeah.
Is there anything else you need to know? How did we do? Did we talk too much, etc.? We just love to know your feedback. So for next time, possibly, what would you like? We've covered everything today very, very quickly. So we can go into more detail on other subjects. Yes.
Sheila, if an OT sources a power wheelchair from IMNDA, are we able to make slight modifications to these?
Yes. Excuse me, frog in my throat. Sometimes they say that the equipment will say adjustable, and then I'll go back to Healthcare 21 and they'll say a part needs to be ordered in order to adjust it. So it depends. A lot of the smaller things, yes, can be done, but if parts need to be ordered, just keep in mind it can take a few weeks. But yeah, things can be adjusted in Healthcare 21.
Okay. Will Delta remove the Stairlifts when it's no longer being used or part of their service?
Yes, they will.
Yeah, we will do. Absolutely. I make sure I'm not missing out. And can clients apply for grants for small aids that aren't provided via HSE or IMNDA? Our grants are specific to services. There's no pot of cash that we have. It has to go towards a service, and that's the way our funding is, unfortunately. Do you have to go through CRC for assessment for an iGaze system?
Not necessarily. Preferably yes. It doesn't have to be CRC. It can be Enable Ireland, or there are a lot of really good OTs out there and SLTs who know what kind of system they need. So if you're not sure, then you have to go through Enable Ireland or CRC, but you don't have to. If you have enough information and education about that particular piece of equipment, absolutely. But they're expensive, so it's hard for us to deliver something if the client has to know how to use it, obviously. But yes, no problem.
Thank you, Kate, for your lovely comments. As Kate SLT, just thanking Paul and Lisa for their incredible service. Thank you very much. Margaret, I'm familiar with HSE Asset Track. Is MND Asset Track different?
Identical.
There you go.
Isn't it, Lisa?
Yep,
Identical?
identical,
Yeah.
apparently so, same layout. Yeah.
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 The only difference, I think, in HSE, you're allowed to deliver and collect. Unfortunately, we have to put that process through our system so that we know what's been delivered and collected.
Yeah.
So it's identical. Yeah.
Okay. Sarah, if a medical team are saying someone had MND but no official diagnosis from a neurologist, will they be accepted? Do they have to have a diagnosis from a neurologist before they can register? Because the services will kick in as soon as they are registered, but we must have that diagnosis. Do you provide a variety of iPad covers or just the standard black ones that they usually come with?
No, just the standard black ones. As is, it's every week we're buying sort of 15 to 20. If we were to do a variety of covers, we'd turn into an iPad shop. We only have kind of so much storage for
but they
iPad.
don't actually come. Yeah, they don't actually come with iPad. We have to buy the
We
iPad
buy
covers
those
separately.
separately.
So
Yeah,
the ones that
yeah.
we buy are pretty
They're
sturdy.
really sturdy.
robust.
They're
Yeah.
specific, yeah, so that if they are dropped or anything, that they'll survive. Yeah,
Is the iPad reusable?
absolutely.
Do you provide Apple stylus pens or LCD writing tablets or whiteboards?
No, we don't. Only iPads, I'm afraid, and the covers to go with them.
Are clients aware of the range of equipments available? So it really is, it's a conversation between, you know, the nurse, the healthcare professional as to, you know, the needs. Like clients will ask, and the nurses are au fait with what we use. But it's very much on an individual basis, what is needed and what we have and what we can reuse. So it's very individually assessed.
Yeah.
Seriously, just want to say a big thank you to Paul and Lisa. You're always so helpful and willing to work together. Great. Thank you, Nicole. God, these girls they won't be able to do anything for the afternoon. They'll be like, wonderful. It's great to get this feedback. Thank you so much. Cheers. Thanks, Emma, dear. Their fabulous input over the past year, making such a difference, clients. Thank you very much, Sheila. No question, just I say thank you to Paula. So helpful with my patient required iPad. Thank you. Thank you so much. Do you provide variety of iPad? Oh, I've done that one, haven't I? Sorry, it's gone. Oops. I think are we nearly? Hang on, no, not finished yet.
One there, Naomi. Do iPads have to be returned when no longer in use?
Good
What we
question.
would say is, if it's an easy thing, we'll absolutely pick it up. If the family doesn't want to hold on to it, if there's not kind of, you know, some people feel there's photos and stuff on it, and we have no problem leaving those iPads. But if an SLT can get the iPad back, yeah, absolutely, hold on to it to trial with your next client. Usually what we do for picking up iPads is if they're there to be collected in the family home, we'll collect them and then we wipe them. But if you get an iPad back into the office, hold on to it to trial with somebody else. Just let us know the number, the asset number on it, and we can transfer over the owner's name.
Okay. I'm just trying to, Mary, no question. Thank you. Thank you so much, Valerie. I know there's another question here. I'm just trying to, oh, there we go. Sorry. Returned. Can I double check? If a client goes into long-term care, hospice care, they bring their equipment, or can the equipment be provided direct if a client is already resident? If the client goes into long-term care or hospice care, sometimes the equipment will go with them. Very, like occasionally, if it's a very bespoke, specific piece of equipment, the piece would go with them. Very much depend on the individual situation. Correct me if I'm wrong, Paula, Lisa.
No, absolutely. Yeah, it depends on the nursing home, really. If there's something in particular they'd like to bring with them, just let us know. Yeah, obviously, like in every situation, nothing is ever in black and white, so we can always find out for you. And if we can do it, we'll absolutely find out. Yeah.
I'll just say as well, I'm getting feedback, Lisa. Do you want to go on mute for a second? It's nothing worse than hearing your voice twice. Bad enough once. One thing about equipment as well is that when people are going on holidays, potentially they ask, can they bring their equipment with? We can't do that. We can't bring the equipment to the holiday home with them. Unfortunately, it's just out of our bandwidth. It can go to their home and we can swap it out for new equipment, but not it can't really travel around the country, because that's just we just can't.
The
do
time
that.
frame is too complicated.
Yeah, it's you have to, yeah. Double iPads to be returned once no longer used. Yvonne, eye gaze equipment. Have I ordered this before through IMNDA, but now do I go through CRC?
Okay, so if you don't have to go through CRC, so if you know what you're looking for and you know what the client needs, the first thing to do would be come to us and say if we have it in stock. If we have it in stock and you know exactly what pieces of item you need, absolutely no problem, we'll have it delivered. Then if we don't have it in stock, then I would need quotes. So the quotes would come from the likes of Smartbox or Smile Technology. But you don't need to go to CRC unless you need real advice. So if you're able to do it, that's even better for us because it'll work faster. Speaking of CRC, if you feel somewhere down the line that your client might need assistive technology and you're not sure how to go about it, get the name onto CRC as soon as possible. So CRC have an application form. You just need to fill it in and send it back to CRC. Then that person is on the books as opposed to a waiting list. And you know what, if they don't need it, you can just cancel the request. I always think, get the information in there, ask, and then if you decide, no, it's no good, you can always cancel the request. But the answer to your question really is, no, you don't need CRC. If you know how to do it, fantastic. We'll help you out with that.
Great. I can't see any more questions. Oh, and just thank you, everyone. Thank you. Great session. Yes, we will have the slides as well as the recording, and we will send them on to you. Just as well, everything that Paula and Lisa have presented today is on, and myself is on the website as well. So if you're looking to have a little recap yourself, we will send the link to the information on the website as well as the presentation and the recording, and we'll add them to the website as well. So the next webinar is going to be in September, and we are hoping to do with presentation with Leslie Doyle around voice banking. So just a little bit more of a spotlight on voice banking. Hopefully by then we will have the I Will Always Be Me app and we can cover that. But Leslie is kindly going to do that presentation for us. So hopefully you'll be able to join us for that. We will send all of this information to you with a little evaluation. We really want to hear your feedback as well. And it's great to have so many people join us today. Thank you so much. We know you're all so busy, and we will continue to do the webinars. And yeah, send us your feedback and we'll just keep presenting to you. We'll do this on a monthly basis. So just check, make sure there's no other questions. All right, thank you. That's great. Okay, I think that's it now. So thank you, Lisa. Thank you, Paula.
Very welcome.
Thank you.
Just
Thank
the
you,
last one
everyone.
there. Sorry, Naomi. Lorraine O'Hara. Just
sorry, I
want
missed
the
one.
presentation slides be sent with the recording.
Yeah.
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 Oh, sorry, Mary, you couldn't get the chat option. I don't know why that is.
Oh dear.
But your chat option not available. Just to say thank. Well, you're in the chat now, Mary, so you found it. So well done.
Yeah.
So thank you very much, everyone, and we will talk to you again very soon. Thank you.
Say one thing, but not at all.
You can,
Thank you
of course.
all. I was going to say, on our website, if you go into how to order equipment, I have it at the top of my page all day, every day. Just click on it and go, do they do? Ah, great. It just kind of get into the habit, and then you'll get used to what we do and what we don't do. So feel free to go onto the website instead of kind of, doing extra work for yourself or whatever. So we'll update it as much as possible if we're adding any new items, and maybe we will. The world of M&D is all sorts of new technology arriving. So feel free to go onto the website and just check what we do all the time. And thank you all very much for your attendance.
Great. Thank you, everyone.
Thanks, everyone.
Okay.
Thanks, ladies.
Thank
Thank
you.
you.
Bye.
Bye. Bye now. Bye.